Okay, eating disorders. The eating disorders anorexia nervosa, bulimia nervosa, and also binge eating disorder. Let's start with anorexia nervosa. BMI is less than 18.5, and these patients have a very intense fear of having weight gain. They generally will present to you as if they have a very distorted view of body weight and shape, not only of themselves, but just as a standard. The treatment for anorexia nervosa: number one, cognitive behavioral therapy; number two, nutritional rehabilitation; and also you can give the patient olanzapine if no response to first-line treatments work. Olanzapine is a second-generation antipsychotic, and it's used in schizophrenia, bipolar disorder, and acute psychosis, along with a lot of other psychiatric disorders. However, it does cause metabolic effects, but the metabolic effects can be very helpful for people with anorexia nervosa. The one thing you want to look out for, of course, is neuroleptic malignant syndrome. Next is bulimia nervosa. These patients have recurrent episodes of binge eating, but on top of binge eating, they have inappropriate compensatory behavior to prevent this type of weight gain. So they excessively worry about their body shape and weight, just like anorexia nervosa patients, but they also, on top of that, might throw up by inducing vomiting, and because of this, they can present with parotid gland hypertrophy, pharyngeal erythema, have dental caries, have scars or calluses on their hands from contact with their teeth. This is classically called the Russell sign. For bulimia patients, again, you want to try cognitive behavioral therapy, nutritional rehabilitation, of course, and you can also try SSRI again if the first-line treatments don't work. You can use something like fluoxetine in this case. For SSRIs, you want to look for nausea or mild tremors as very typical mild symptoms of serotonin syndrome. And yes, this can occur from SSRIs alone. Lastly, binge eating disorder. This is when patients have recurrent episodes of binge eating, but they don't have any compensatory behaviors. They just show a very big lack of control during eating. Again, cognitive behavioral therapy, behavioral weight loss therapy is important, and SSRIs. Specific medications that can be used are like lisdexamfetamine or topiramate. You use the latter medications for patients who don't respond typically to their SSRIs, and what it does is reduce weight gain from binge eating or impulsive behavior. You can even try methylphenidate to reduce binge eating episodes themselves. Methylphenidate acts as a central nervous system stimulant, and it functions by blocking norepinephrine and dopamine. By stopping the reuptake into presynaptic neurons, patients can have less appetite.